Joint replacement surgery has changed a lot over time. Some of you may remember a time when patients were discharged from the hospital into a skilled nursing hospital or rehabilitation unit after their joint replacement surgery. Some of you may have remembered patients staying in the hospital for 2 to 5 days and going home with a home health nurse and physical therapist coming to their house for 2 to 4 weeks. These are very rare pathways now.
Skilled nursing facilities and inpatient rehab centers take care of some of our sick patients, including the infected patients. We have learned over the years that patients who pursue care in a skilled nursing facility or inpatient rehab center after hip or knee replacement surgery are between 5 to 15 times more likely to have a complication after their surgery.
In-home therapy programs provide convenience for patients who are recovering from joint replacement surgery, but the therapist does not have the same tools at your home that they have in their clinics.
We have learned that our patients recover faster and more effectively if they're engaging therapy services in an outpatient clinic than in their home. If you are physically able to walk 75 to 100 feet and are able to get in and out of a car, you will probably recover faster if you attend outpatient physical therapy than if you have therapy services at home. Because the costs of medical care have been increasing, people have been looking for ways to decrease joint replacement surgery costs. Surgeons around the country have been advocating for some patients to safely go home on the day of their surgery, and most patients have been going home the day after surgery for many years now. This has happened with very low risks of short-term complications or long-term joint replacement problems. While pain control may not be ideal during this first few days after surgery, patients are still able to go home and get well. Thanks to our preoperative rehabilitation or prehab program, most of our patients are successful in progressing quickly with their physical therapy after surgery and are able to recover successfully at home. The length of your hospitalization may depend on your insurance plan. For most private insurance plans, you may be expected to be discharged home on the day of your surgery or within 23 hours of your hospital admission. If you're on a Medicare or Medicaid insurance plan that is managed by a private insurance company, you may also go home on either the day of surgery or before 8 a.m. on the day after your surgery. If you're on a traditional Medicare plan, we will plan for you to stay in the hospital for 2 days, but we'll let you go home the day after your surgery if our physical therapists determine that you can walk safely with a walker or crutches and your health conditions are stable.